I was given by Craig and Lisa were to produce a meta-analysis of the impact of microinsurance in changing people's behaviors. And in my naivety at the time, I thought it's an easy task that turned out to be a way more sophisticated task that I thought. So just finding, first of all, through all sorts of sources, the papers that could be relevant, that brought us to about 750 papers that we should select based on, do they have measurable results of real impact in changed behaviors? And through this selection, we reduced them to 40 papers. And on these 40 papers, Severine and Ida helped me do a summary of what the conclusion of these papers are, what kind of changing behaviors we observe. And there are some students in this room, which I asked to wave their hand, which are now working, they are very timid. They are now really working on the real meta-analysis, but taking this 40 paper, trying to group them in a way that we can really perform a meta-analysis that says yes or no, this kind of impact is a result of microinsurance. So I will stress a bit, Severine, because this is a kind of research. It's not exactly the type of mathematical research we do every day, but was very interesting for us. So good luck, Wiley.
Thank you. So hi, everyone. So as Corina mentioned, well, she didn't really mention it, but I find myself presenting that work while I'm really not the brain behind it. So the brains are all my co-authors, Corina, Lisa, Aparna, and as well Ida. So I still don't know why I'm here, but let's do it. And she also asked me to do it quick, so like in 5 minutes. So I'll try to give you the key information that we gathered about that. And we have to mention that it's still a work in progress. So we went through the papers. We are still trying to get more of the results that we have. So here I'm more presenting the literature review, the kind of observation that we made over the past 10 years or so. It's not working. Yes, I have to click. Yeah. Okay, so one of the first observations that we made is that, of course, closing insurance somehow is related to SDGs. And the SDGs that were the more often mentioned directly or indirectly in the 40 papers that we read are summarized here. So there are like SDG 1 for poverty eradication, health outcome, SDG 3, empower women, SDG 5, economic growth, SDG 8, and climate action related to SDG 30. So here are the key ones that we regularly found in all the papers that we went through. Then, as Corina mentioned, what we were really looking at, it was not necessarily the SDGs and how they were involved in all those papers, but it was more, how does it change? Does it have an impact on behavior? And does it change that behavior? And for that, we grouped them in 4 different categories that I summarize here. So the first observation that we make is that it does change the production decisions on how they decide to produce or to have some income. And within that main category, we find 3 subcategories. The first one is the impact on input use and crop production. When they do have insurance, they are able to use different machinery or tools, or choose different crop that might be more risky, but that will be with higher return. So that's several papers that we found. Most of the papers were for Africa or in Asia. They do show that for different products. Then the choice of crops that they are using, how they invest, investment behavior, and also that it impacts naturally economic growth and productivity. Then the second big category that we saw is the impact on health and well-being. And within that general category, again, we have several papers that we could group in these 4 subgroups that you see here. Some papers were discussing the impact on health expenditure and how those products, mainly health insurance, will help some people to reduce their expenditure related to health and also improve their access to healthcare. Then we had several papers that were also discussing self-medication and hospitalization, how they could have access to hospitalization if they could use less self-medication in order to have medicines and so on from doctors and hospitals. We had a few papers that also show that managed to measure that it had a positive impact on nutritional status. So they were, since they didn't have to deal themselves when a problem occurred, they could still eat normally or good food, good quality, and that improved nutritional status and food security. And finally, a few papers also were discussing the reduction in mortality and health impact. And some of them were especially focused on child mortality under 5 years old. And they really show that, yes, it helps for those countries where they have these types of products, we reduce child mortality quite substantially. So I skipped that because it's what I mentioned just before, since I have a very short time. The third groups that we looked at, or that we noticed, is the coping mechanisms. So thanks to inclusive insurance in different products, people were coping differently when a risk occurred. And the first one is the impact on child labor. So some papers show that indeed, thanks to inclusive insurance, people didn't need to take their child out of school in order to make them work, to gain money and so on. So it has an impact on child labor. Also for borrowing behavior, they didn't need to borrow so much money because they had the insurance that was here to pay for what was needed to be paid. It also helped to protect the assets, meaning that they didn't have to sell their assets or to sell them their herd and so on in order to be able to deal with some catastrophe. And finally, papers are also discussing the impact on education and consumption expenditure, which again, as we can guess, it can help for people to have a better education and to have a better consumption and so on. And finally, the fourth category that we saw from all these papers is related to financial protection, which what we meant by that, again, we had 3 subcategories and we could classify the papers in these categories. Some of them were showing that it's a reduction in out-of-pocket expenses. Some others shows that it was improving the income and savings of those community or those groups. And finally, some of these papers were discussing the contribution to inclusive growth. So that's a very short summary of 40 papers that we went through, but that gives you an idea. And most of these papers, they were observing similar things. So in different contexts, being in Africa or in Asia, the message was very often the same. Sometimes there were some contradiction, but most of the time they were on the same, with the same conclusion. So yes, so we believe that when we looked at all these papers and what we need to do, we think that there are a need for a collaboration between policymakers, practitioners, and researchers in order to enhance this financial literacy that we already discussed and try to strengthen the regulatory framework and expand access to inclusive insurance, as we already discussed with previous talks that we saw. And one of the key aspects that we wanted to mention is that it's quite important to find a way to empower these communities in order to be able to deal with those risks when they happen. So I think, Corina, I did it in 5 minutes.
If you have any questions for the guests, during the coffee break. So 20 minutes coffee break, and then we are ready for our last session on digital wages. Thank you to all the speakers of this session.